My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Mwesigwa Joy and I am your host. Thank you so much for tuning in this Saturday. We're happy to have you. And for those who are new around here, on this podcast, we basically discuss health, all aspects of health, mental health, pediatrics, gynecology, any aspect, orthopedics, which are like bones, any aspect of health. We just want you to be able to manage your own health, and knowledge is power. So we want you to know how to prevent the diseases that are common, prevent the illnesses, the signs and symptoms, when to seek help, and everything to do with health. And also we're touching aspects of health that are outside the hospital, like community health, health and law. And I'm sure you've seen one of the episodes on health and law. If you haven't watched it, you can go and watch it. So for today, we're going to be talking about community health. And we're going to talk about what role you have to play as a person out there in order to bring these health services to people, make them more accessible. So I have a beautiful guest here with me. Her name is Melinda. You're welcome, Melinda.
Thank you, Joy.
How are you doing?
I'm okay. Thank you for having me on this podcast.
We're also happy to have you. Could you introduce yourself to the audience, who you are, what you do, and what organization you're from?
Well, my name is Matsiko Melinda. I am currently still in school. I'm pursuing my Bachelor of Medicine and Surgery. I'm in my 4th year. And today I'm here as part of Pro Bono. So Pro Bono is a group and youth-led nonprofit organization that deals within community. It works through outreach programs at various sections of community and works with the community to integrate the specific needs. So Pro Bono has actually been part of us for the past 5 years. It was founded by one of our own, Faith Aiko Owit, and she has been able to gather a group of youth and distribute them into various sectors. So we have the FAMES, we have the health, the educators, and the environment. But for today's podcast, I'm here with Pro Bono Health. Particularly, I'm one of the heads of Pro Bono Health, blessed to work with the community as well, and community health as you're talking about.
Okay, so what are some of the things that Pro Bono Health does? Okay, to start with, why did you decide to do Pro Bono Health?
So at Pro Bono Health, one of the things we do is embrace the power one has over community. And for me to know that someone doesn't even need to do a medicine degree to have impact within the health society makes work so much easier for me who is within the health community. It makes me feel like something that I'm doing is not for me, but for the people, and the people are also involved. So it's not the people just coming to hospital for dependence, but also them, because it's their life to begin with, but also them being involved. That's what made me want to join Pro Bono Health, because each and everyone has the right to deal with their own health.
Yeah. So what are some of the things Pro Bono Health does?
So for Pro Bono Health, we actually started 2 years late before this year. And one of the things that we've been able to do is mental health so far. So mental health, as the years progress, it's one of the things that the World Health Organization has seen as a very big problem currently. And so one of the things that we're able to do about that was create an outreach program in one of our high schools. It's Gayaza High School, because yes, we see mental health, okay, us as adults, we work, we have responsibilities, we're stressed, but also the people that go to school, the children, they also have their own problems, the educational pressure, the friends that come in high, it's a lot. So we looked to focus there for that time, but we hope to do more as time goes on.
Okay, so mental health is really important if you're listening to that. So what do you have in store for us for this coming year? What do you have in store for us as Pro Bono Health?
So Pro Bono Health this coming year, we actually wanted to really go big this coming year, because we've only done mental health mainly, but we also now wanted to look at more of the physical health. Yes. So in terms of this year we had decided to look at mainly cancer. Yeah.
Yes.
So for cancer, we had decided to do general health education about cancer, because it's important for people to know about some of these things. And aside from the health education, we also wanted to reach out to the community, engage the community with what's this about cancer that's going on. And in doing so, we also wanted to tackle other things. We wanted to do there's something called tertiary prevention. Yes. So when you're looking at tertiary care, it's when you try to prevent the disease before it even comes about. Yes, so we want to reduce the burden that's coming to the hospitals when we can actually do these things like from the baselines, from the basics, things like immunization. So it's what we want to do. We want to organize a medical camp that's going to be within the community. Most likely it's going to be located in an area that's underserved. We want to make healthcare accessible, trying to bridge a gap when it comes to things like affordability. And even the government has tried to create places like Mulago where people can go to for treatment and it's free of charge. But even some people can't afford to reach there. Yes. So we're trying to bridge those different gaps and improve healthcare in that way.
So what exactly is going to happen on this camp?
This camp, first of all, we want it to be free. Yes. So that the people can come and just access all the health services because everyone has a right to health. And among the things that are going to happen is, first of all, health education. Yes. And among other things to happen are screening tests. We have diseases like HIV, we have malaria, we have typhoid, we have peptic ulcer disease, we have typhoid, among all these other common things that tend to happen to break out in our areas that we stay in. And among other things is we also want to focus on the cancer a bit and do screening for it. We also want to be able to do immunization in regards to that cancer. Things like the HPV vaccine that girls most likely below the age of 14 can access.
So when is it going to happen, and can the community help? Because people are watching out there. Someone could be watching and they're like, you know what, I also want to be part of this. I want to help the underserved communities with their health. So how can someone help, and when is the camp?
So to begin with, the camp is going to be on 22nd February, yes? And I'm actually glad you asked how people can help, because we don't think we can do this without people, yes? So people can reach out to our platforms. They can reach out if they want to participate. If you're a medical student and you have skills that you think you can help the people around you with, you don't have to be in 5th year, 4th year. You can even be in 1st year as well. And even when you're not a medical student, you can still be able to come and be on ground and help. You can also donate things like anything you feel like can help anyone.
Okay, so you also talked about how Pro Bono does health promotion, yeah? And so I'd want us to dig into that, maybe the importance of health promotion, and you could give us like maybe a story, like you see, like there's this story of the lady of the contraceptives and the PE, so you could also talk about that so the audience can know the importance of health promotion and why we should do it and engage in it.
Yes, so one of the importance of health communication is that most likely when you come to a program like this, and I'm talking about helping community, people are only going to think about the slums around us, yes? But you yourself, you're part of the community. Each and everyone watching this is part of the community. And so we all face different things that happen to us every other day. Like I'm looking at, for example, the universities. When we look at people in the universities, obviously, some of them are engaged in sexual practices. Yes. So, for example, most of them will most likely use like the emergency pills, the morning after pills. And these are examples of hormonal contraceptives. And these hormonal contraceptives, most times there's a whole positive feedback, negative feedback when it comes to your hormones in your body. And when there's this interaction, sometimes you end up developing things like pulmonary emboli. So pulmonary emboli are actually one of the fastest killing things, and they're actually regarded as medical emergencies. So that's the importance of health education. The other thing is that you can't expect each and everyone to know small things like, when you're going to get married to someone, ask them, let's go test for HIV, let's go test for sickle cell, because when you do things like this, it helps you in the future. And also another thing is, like, for example, when you're looking at sickle cell, fathers leave homes when they find out their children have sickle cell, because they don't know that sickle cell is something that two people have to contribute to. A woman can't have like a sickle cell trait and a man doesn't have it, and she gives birth to a child with sickle cell. So all this health education helps us really know what's going on. And yes, okay, if you want to continue with this journey of you've already met your person, you both have the sickle cell trait, how do you go about it? What do you have to expect with your child and things like that? I feel like health education actually entails so much.
Okay, so you've talked about a very important aspect, and that's sickle cell disease. So you've been in the medical practice as a student, right? In ward, do you have any story about a sickler that really touched your heart? Like maybe you could paint a picture for someone out there who he has sickle cell disease and has never seen someone. I may not take it serious. Yeah.
So actually, one of the people that we were able to come across in the sickle cell in the ward that had sickle cell, she was about 8 years old, and the mother was a single mother because the father had left them because of this sickle cell. Like, men, they'll be like, in our family, we don't give birth to children that have sickle cell. So this is a single mother that's taking care of a child with sickle cell. Now, sickle cell is a very delicate thing. Because the cold can affect them. When it gets too hot, it can affect them. Dehydration can affect them. And they keep getting crisis. And this crisis lead them to so many different things. Actually, one can even get a stroke. Yes. So there's that child, and you're seeing this single mother, she's struggling, she has to work, but at the same time this child is always mostly in the hospital. And I think the saddest case I saw was, this boy was not even 13, he was 11. But by the time he was brought to the hospital, he had a stroke. Yes. So, it was a way of, this child is not going to survive. When you are a doctor and you have to break the bad news to the patient and you see, we're doing our best. You can take care of this child, you can feed them, but this is irreversible. And that's very heartbreaking when this could have been prevented, from back then before you even got married. Yes. And that's one of the saddest things I've had to witness.
Okay. To our audience, hope you've heard about that. But sickle cell disease is a loud killer. Some diseases are silent killers. This is a loud killer. It will affect you financially, mentally, affect your child. And most of them sometimes don't even survive past 18 years. So let's make informed decisions. Yeah. So you also talked about mental health. When you went to Gayaza High School, how was that? Did you find, what were your findings? Did you find out anything about the mental health of those children? For maybe a parent who's watching, did they even have any, sometimes parents think that once they've taken their child to a school that is even good, they've given them what to eat, they have given them everything, they think automatically you're supposed to be happy. So did you have any findings from that camp? From that experience? Yeah.
Yes, well, we were actually able to give out a survey at the end of each and everything we did, because we did give them a talk first, and then we integrated it with art therapy, because we have to find different ways to engage those young people like with their mental health. So we were with Artsy. Yes, you can look for them on their platforms. And then when we did this surveys, we found out that most of the children had like issues with like friendships, parents coming to terms with their grades, or having in terms of what they want to do in their A levels, because most of them sent their O levels. So that was like most of the time. And then some had, not all of them were too engaged about, the whole mental health thing. Like, yes, some of them had heard about it, but they weren't too prioritized on that in their lives. Yes, that's what we were able to find out.
Okay, so clearly Pro Bono Health has been so impactful in the community. So if someone is out there and they would want to, is there a provision for someone to join your community, the Pro Bono Health?
So yes, currently we have our social platforms. So if anyone feels like they want to join us, if anyone actually feels like they also have an idea they want to raise within their community, we can be able to promote them to do that. Everyone is actually always welcome. They should just reach out to us and we'll tell them the necessary steps to which they need.
Are you also open for partnerships with different organizations that could have the same values and objectives with you?
Yes, we're actually very, very open because you can't work alone. You really can't work alone. So we would be open to any organizations, any foundations, everyone that has the same goal as us to improve healthcare access among the community. Yes.
Okay, so as we come to the end of this episode, I'd want you to talk to the people, give them closing remarks. What message do you have for the people in regards to community health? What role can everyone play, whether you're a sister, a mother, a friend? What role can someone play in terms of community health?
Well, in terms of community health, you just always have to remember that health just not stop at just being physical, but actually it's also a state of well-being, mentally, spiritually, all that involved, yes. And we're all supposed to be each other's keeper. We're all supposed to look out for one another. Be interested in health education. Watch my doctor podcast whenever you can. And also be informed, like knowledge is power, as Joy said when we're beginning, and you'll be able to manage your life right.
Yeah, thank you so much, Miss Melinda, Dr. TB. Thank you so much for coming and talking about Pro Bono Health and telling us the importance of community health. To our people out there, I hope you have learned that everyone has a role to play in regards to health, whether it's to your own health. And the first role you have to play is knowledge. Like Melinda said, you have to have the knowledge to know how to live a healthy life. And you have to have the knowledge to know how to help the people around you. Yeah. So also, before we close, I would like to reemphasize the camp that we're going to have. We're going to have a camp on the 22nd of February. We are collaborating with Pro Bono Health. My doctor's collaborating with Pro Bono Health, and we're going to be in Kalere, around Kalere Market. So we're going to be delivering different services, testing like malaria, like she talked about, typhoid, H. pylori, HIV testing. She talked about the sickle cell trait. We're going to have a lot of tests there. We're going to have some drugs availed. I'm also going to have health promotion, talk to the community about different aspects of health. Yeah, how can you check yourself and know if breast cancer is developing? All that is going to be amazing. So if you want to be part of the experience, please reach out to our platforms, either the My Doctor platforms or Pro Bono Health platforms, and you'll be able to join us on this journey. You can also feel free to donate anything that you have so that we help the underserved communities. This is My Doctor podcast. My Doctor, your health anytime, anywhere.
My Doctor, your health anytime, anywhere.